My name is Megan Robinson, and I am currently living in Omaha, Nebraska. I am a master's student for the Family and Human Development program with an emphasis in child life at Arizona State University. I'll be talking to you today about the need for mental health training for teachers to help children with mental health problems and their families receive the proper support and resources that they need. This topic has become a strong interest of mine for very personal reasons that we will look at later on in this presentation. There has been a significant rise in mental health issues in children in the last 25 years. As many as 20% of children suffer from some kind of mental health issue, such as anxiety, ADHD, OCD, depression, and many others. Of those who suffer from mental illness, only 1/3 of those children get professional help. Anxiety was previously thought to be a normal part of childhood development that children would eventually just grow out of. We hear about, we learn about, and we teach about separation anxiety or stranger anxiety as being normal steps of childhood development and being able to progress to the next stage when that isn't an issue anymore. However, these other anxieties have become more pervasive and have affected more parts of a child's life and their development, becoming more long-term and developing more issues because of it. The American Academy of Pediatrics found that mental illness went from 7% of children to over 19% of children diagnosed with mental health issues in the last 20 years. Now, there are a lot of opinions, a lot of thoughts, a lot of correlations, and I'm sure plenty of research that goes into why there's an increase in mental health issues among children in the last 20 years. However, this presentation will not be going into why the mental health problem has increased. That could be another presentation and a paper in and of itself, and for that we just do not have time to cover it. Instead, this presentation will only be focusing on what we can do to solve the problem and help the children that have been diagnosed with mental health issues, and how the schools can be a major part of the solution. Currently, schools are unfortunately unequipped to handle the rise in mental health issues. In low-income areas especially, they have very low funding to maintain any sort of mental health services program, if having one at all. Low-income areas also have the greatest risk of students who have mental health problems and who would have long-term issues related to those mental health problems. School psychologists are usually present, but there's only one counselor for every 1,400 students. Social workers are another level of help, but again, there's not enough to go around, and they're usually overworked and underpaid. In our area, social workers are not at every school, but they cover a district, which means they have more caseloads for every school that they handle. Teachers themselves are pressured to maintain academic scores. Because of that pressure, they can sometimes seem unempathetic to students who are suffering or just not even notice the signs and the symptoms at all. They're too overworked maintaining their large class sizes to even focus on one student when they have many students who need their attention. With the rise in mental health issues, there's just not enough adequate programs in place to help those who need it. Mental health services are not always available to students, especially in low-income areas as mentioned. There are also not enough funds to provide for mental health services in students in all areas and to provide screenings. So why is this a problem? Why is mental health issues among young children a problem? Why is it not just a developmental issue that can be resolved over time and through lots of patience? It's because mental health issues in young children become mental health issues in older children and in teenagers and into their adulthood. It becomes a long-term issue for that child. Elementary-age kids with mental health issues are more likely to struggle academically and have long-term mental health problems. Without getting mental health help early on, it can lead to major anxiety and depression. According to American Academy of Pediatrics, 20% of children with diagnosable mental health issues are more likely to follow at-risk behaviors, including 30% of underage drinking and 9% of reported suicides. Suicide being the third leading cause of death of children ages 10 to 19. Currently, I've been working at the Boys Town National Hotline, which is a suicide and crisis center for youth and young adults. Just the other day, we received a call from a 9-year-old boy who wanted to kill himself. 9 years old. He said he knew it was wrong and he didn't want to do it, but he just couldn't get rid of the thoughts telling him to do it and to kill himself. We were able to get in touch with his school, who had no idea that this was a problem, that he was depressed or had any kind of anxiety. The school was able to contact the parents, who hopefully got the child professional help that he needed so that he could feel at peace again and be able to control those thoughts and control those emotions. Now, I just want to add, we don't usually reach out to the school or parents unless we felt like there's a major issue or someone was greatly at risk and their life was in danger. And in this case, we felt like this 9-year-old boy was in grave danger of hurting himself. At 9, he wanted to end his life because he couldn't handle the struggle in his own mind. And it wasn't until he reached out to us that his school was even aware that this was a problem for him. And we hope that he received the help that he needed. And we're just very grateful that he was able to receive it when he did, because we don't know what would have happened if he didn't somehow reach out to us and find out about this hotline. The Great Smoky Mountains study of youth also found that youth with a mental illness are 3 times more likely to experience mental disorders later on with a long duration. So why schools? Why should schools be a part of the solution for helping children with mental health issues? Well, first of all, schools are where a child spends a majority of their time. 5 days a week, 8 to 4, a child is at the school learning and growing. They are developing close relationships with their teachers. Their teachers know the child just as well, if not better sometimes, than the parents know their own children, because they spend more time at school than even in their own home. The school system is the best place for children to be able to get the most help and the most comprehensive care. In addition, it has been shown that children who need help are 10 times more likely to get the help they need if services are provided at the school and not at a separate location, putting more time, money, and transportation stresses on the family. Parents are already dealing with enough. They're running their kids from many different appointments and extracurriculars and school and after-school programs, that one more thing added to their schedule may just be the last thing that they can handle, and they won't be able to get the care for their child like they need. Being able to have it all-inclusive at the school altogether, with the administration and the teachers on board helping to support the parents, gives a child a better chance of getting the help that they so desperately need. Back to why this is such a personal issue for me. This is a picture of my son. It's kind of old, but currently he's 7 years old. This is when he was a little younger. My son suffers from major anxiety disorder and OCD, and he has suffered from it for years. We have tried to get him help and talked to so many of his teachers, to only be told that they can't do anything for us. He comes home from school in tears from holding in his emotions all day and being too scared to speak up in class. He has paralyzing tantrums even at 7, and he has really low emotional regulation. We've worked a lot with him at home, but much of what we don't know is what happens at school, and school is when he gets his most triggers. And that is where we can use the most help. Like I said, I've talked to his teachers for over 2 years and usually get stonewalled. I'm usually told that they don't understand how it's possible. They don't understand who or how what I'm describing. They haven't witnessed it themselves. Because of his anxiety, it stops him from acting out as much at school because he's terrified of his teachers and of his peers. And so the moment I pick him up from school, he just crashes and burns in the car. I've talked to the principal, I've talked to the school counselor, only to be told that another person can help me and another person can help me, and given a big long trail of people that eventually can't help me. They have very little that they can do and very little resources, usually just referring me out to someone to make some appointment to hope that my insurance pays for it, and to end up just too much to schedule into everything. They also kind of downplay the situation, thinking that what I'm describing is just an overworked parent that has very little patience for their child, instead of looking at it as a major health issue for my son. We have gotten him helped outside of school, but without the school being on board, it creates another sort of problems. We can't get the school to admit that there's some issue, which makes the doctor sometimes not be more reluctant to help us as well. And it's really hard to move forward with any kind of help and resources for him. And my son is not the only case I've heard of. I've talked to many other mothers who have children with mental health and behavior problems, and the schools aren't concerned, or there's very little they can do for them. They're not doing enough. The teachers are not actively helping. There needs to be a change to get these sweet babies and their overwhelmed parents like me the help that they need. So what can be done? What can we do to help these children with mental health issues to get the help and care they need? What can we do to help the families who are just simply too overwhelmed to deal with it all? It is recommended that schools be given opportunities to provide more comprehensive care for the students, starting with a thorough training course for teachers. Comprehensive care in the schools is going to be key to helping a child get the early interventions that they need, and will help combat those long-term issues that they are most likely going to face with mental health problems. Teachers who are able to be trained to notice and identify mental issues in a child is going to be able to communicate with the administration and with the parents to be able to get a child into a professional or into any kind of therapy and interventions early on, so that the child isn't needlessly suffering for a too long of time. So many times a child is dealing with so much for so long because it goes unnoticed, either by the parents or by the teachers. Since a child is with the teacher at school most of their time during the school year, it is important that the teacher can be that first round of defense to help that child and to help him get the coping mechanisms and the tools and the emotional stability that they'll need for later on in their lives. Successful programs that are able to help the most children have 3 different tiers. First, a supportive school environment and school connectedness. This is with the teachers, administration, all being on the same page to be able to want to help a child and to support a child and their family when they're going through such difficult and trying times. Second, mental health services and behavior management components, providing the services that a child will need, school psychologists and other programs and therapies for a child to get that help in the school. And third, focusing on the smaller, more severe mental health diagnoses, which will hopefully then trickle down to the more subtle and broad mental health problems that may be more common. But focusing on the smaller, more severe mental health diagnoses first will help it overall. Schools that have started implementing care with these 3 tiers have had a higher attendance records, grades have improved among children, and they have had improved scores on the child behavior checklist. Schools should also help teachers know, understand, and administer the Strength and Difficulties Questionnaire, or the SDQ, which are screening exams, and it helps diagnose children with mental health problems. By a teacher understanding how they work and helping to administer them, it'll help start the process for children to get the adequate help that they need. 70% of children who take the exam are able to get more accurately diagnosed and get proper help. Teachers don't have to diagnose the student, nor are they qualified to do so, and they won't have to actually score the exam, but being able to know how it works, understand when it's used, and give it to a child and their family when they feel is needed will help jumpstart that process for the child to get the professional help or get him into those interventions that they will need. Again, a teacher being able to notice those signs is going to be critical. Teachers should also know that the scoring is reliable and has been tested frequently for validity. And so they can have confidence knowing that when they're able to give it to a student and to give it to a family, that they are helping that family and helping that student get the help that they so desperately need. This is an example of the Strength and Difficulties Questionnaire, or the SDQ. And this is some of the sample questions. It's on a Likert scale: never, sometimes, often, or always. And there's phrases that you would read and then choose your answer according to if they did it sometimes, often, always, or they never did. I remember when we filled this out for my son, me and my husband filled it out, so it gives different perspectives from each caregiver. The teacher could also fill it out. There's a questionnaire for the teacher and other caregivers that are around the child. This helps the doctor or professional get multiple perspectives so that they can more accurately diagnose the child and get them the right kind of help that they need that's geared directly towards them. This is a sample of the scoring sheet for the SQ, and it shows you the different categories in which they're scoring. These different categories are what helps them narrow down where a child falls on the mental health issues spectrum and what is going to be their greatest difficulties and their greatest strengths, where they need the most help, and where they're doing okay in. So as you can see, some of the categories that they're scoring on this is emotional symptoms, conduct problems, or hyperactivity, inattention. The next column would be the score and where they fall in that category. The next column is how the clinical significance of the score relates. So in the first one, for emotional symptoms, they are above threshold. They're very high, meaning they're having problems with their emotions, emotional symptoms. But the next one, conduct problems, is below threshold. So they're able to maintain that pretty well, and they're doing okay there. Above threshold is going to show that that is the areas that are significant, that they need the help, and help them make the proper diagnosis to get the child the right help. Teachers won't need to do the actual scoring. The scoring should be left to the professional, and that they'll be able to give the proper diagnosis and the proper interventions that the child would need. However, being able to understand the scores and being able to know where the child is in the different scores and in the different categories will help the teacher be able to interact and help the child in the classroom better if they're able to make it more personal to that child. And then they can also be supportive in getting them the help and interventions. and having some of those interventions related to their schoolwork and in the classroom. So they can all be on the same page by being able to interweave the mental health therapies and the teaching and be able to help that child more personally and one-on-one. Children with mental health illness can be helped more easily and more readily if we can get the schools on board by providing proper interventions. Children feel safe and protected in their schools. They are their homes away from home, and the school system should continue to protect them even from mental illness. We entrust our schools with so much for our children. Shouldn't we also entrust them in their mental well-being? As Plato said in the Republic, by maintaining a sound system of education and upbringing, you produce citizens of good character. Thank you.